Welcome to the deep dive. Today, we're looking at something pretty fascinating, actually. Could Tadalafil, maybe better known to you as Cialis, play a role in, well, slowing down aging, beyond its usual uses, I mean? Thinking past ED, past BPH, could it have these broader health impacts as we age?
It's a really interesting question, isn't it? Because like you said, most people hear Tadalafil and, think immediately of those specific conditions. So the idea that it might do more, maybe even affect longevity, yeah, that definitely makes you want to look closer.
Totally. We've been digging into this review article. It's called Tadalafil, Potential for Aging and Longevity.
Yeah.
It pulls together a lot of the current research.
It's a good overview.
Yeah, so our goal today is to unpack all of that for you, sort of separate the promising bits from the, well, the maybe pile.
And figure out what the science actually says right now.
Right. Especially for those of you really keeping tabs on health and aging. Okay, let's jump in. How does this drug fundamentally work?
Okay, so Tadalafil is what's known as a PDE5 inhibitor.
PDE5, right.
Yeah, phosphodiesterase type 5. It's an enzyme. Tadalafil basically blocks this enzyme.
Okay.
And when it does that, you get an increase in something called cyclic GMP, cGMP.
Got it.
This happens in smooth muscle cells, and the main effect people know is that it relaxes blood vessels, improves blood flow.
Especially in the pelvic area, hence the ED use.
Exactly, that's the mechanism everyone knows.
But, and this seems key from the review, this PDE5 enzyme isn't just there, is it?
No, that's a crucial point. PDE5 is actually found in lots of places. It's in the brain. It's all through our vascular system, our blood vessels.
Oh.
And that widespread presence is really what opens the door to thinking, maybe, just maybe, it could have effects beyond the local ones.
Which brings us to the core theory, the why. How do we connect an ED drug to aging? What's the proposed link?
Well, the thinking goes like this. By blocking PDE5, you potentially improve endothelial function.
The lining of the blood vessel.
Exactly, the inner lining. Keeping that healthy is super important. And PDE5 inhibition also seems to boost nitric oxide signaling.
Okay, nitric oxide.
Yeah.
That helps relax blood vessels too, right?
It does. It helps them relax and widen. So the hypothesis is that better endothelial function and more nitric oxide could lead to healthier blood vessels overall and maybe less systemic inflammation throughout the body.
And both of those, poor blood vessel health and chronic inflammation, are definitely linked to aging.
Strongly linked. Yeah, that's the core idea.
Okay, that makes biological sense, at least on the surface. But hang on, before we get too excited, the review really hammers home some major caveats. What are the big limitations here?
Yeah, several important ones. First off, a lot of the positive signals we see are coming from observational studies.
Right. Looking back at data, finding associations.
Exactly. So they can show, say, people taking Tadalafil seem to have less of condition X, but they can't prove that Tadalafil caused that outcome.
Correlation, not causation. The classic issue.
Precisely. And related to that is the healthy user effect.
Yes. Explain that again.
It's the idea that people who are prescribed and actually take a drug like Tadalafil might just be healthier to begin with.
Right. Maybe they see doctors more, they're more proactive.
Or they exercise more, eat better, have better access to care, any number of things. So it's really hard to disentangle whether the benefit seen is from the drug itself or from these other factors.
Makes sense. And what about studies looking directly at, like, biological aging markers? Telomeres, things like that.
That's another significant gap. The review points out most studies focus on specific diseases, dementia risk, heart events, not those fundamental markers.
Like telomere length you mentioned, or cellular senescence.
Exactly. Cellular senescence, old cells sticking around and causing trouble. We just don't have much data on whether Tadalafil affects those core aging processes directly.
Okay. And we absolutely have to mention side effects too. It's not a magic bullet with no downsides.
Definitely not. Like any drug, it has potential side effects. Common ones are headache, flushing, back pain, stuffy nose. And then there are rarer, more serious risks, vision changes, priapism.
You're right.
So it's not risk-free. And maybe the biggest point the review makes, Tadalafil is not approved for anti-aging. There aren't any big long-term trials testing it specifically for that purpose.
Okay, that's a really vital dose of caution. So keeping that in mind, let's look at where the research does suggest some potential links. Cognitive aging seems to be a big one.
Yes, it's definitely generated buzz. The review talks about a 2024 study in neurology, Wales et al.
Yeah.
Huge study, looked back at records for over 260,000 men. and it found an 18% lower risk of an Alzheimer's diagnosis among those prescribed PDE5 inhibitors.
18% lower risk.
Uh,
That sounds quite
it
significant.
does grab your attention.
But again, observational. So we can't say for sure the drugs cause the lower risk.
Exactly right. The association is interesting, definitely warrants more research, but it's not proof. And you have to contrast that with another study,
Oh.
the NIH DREAM study, published in JAMA Neurology in 2023. It used sildenafil, that's Viagra, in men who already had early Alzheimer's.
Okay, so a different drug and people already diagnosed.
Right. And over 12 months, they saw no benefit from sildenafil on key Alzheimer's markers like amyloid or tau levels in the brain.
That's important. So one observational study suggests lower risk with PDE5 inhibitors generally, but a clinical trial with sildenafil showed no effect on existing disease markers.
Correct. It really highlights that, one, different PDE5 inhibitors might act differently, especially in the brain, and two, preventing risk versus treating existing pathology are different things.
So the takeaway on cognitive aging.
I think the review sums it up well. Given Tadalafil's known effects on blood vessels, there was that 2024 retrospective study, Fang and colleagues, over 70,000 men.
Okay.
It reported a really quite startling 34% lower risk of all-cause mortality death from any cause in men who had used PDE5 inhibitors.
Wow, 34% lower mortality. That's huge.
It is a very attention-grabbing number, but again...
Observational. Healthy user effect potential.
Exactly. They tried to adjust for some factors, existing conditions, things like that, but the review is clear. You just can't fully rule out bias in these kinds of studies.
Right.
Though it is consistent with Tadalafil's known benefits in things like pulmonary hypertension or BPH, where improving blood flow helps.
So a compelling number, fits with some known mechanisms, but still not proof that taking the drug makes healthy people live longer.
Precisely. It's a strong signal, a flare as you put it earlier, that needs proper investigation with controlled trials. Not established fact for general lifespan extension.
Okay. What about inflammation, that inflammaging idea?
Yeah, that chronic low-grade inflammation driving aging. There was a smaller study, 2019, suggesting Tadalafil might lower levels of CRP. That's a common inflammatory marker.
Okay, but I remember the review had caveats there too.
It did. Small study, like 60 guys, short term. And it focused specifically on men with BPH, not just general aging folks.
Right, so not broadly applicable yet.
Not really. It's a hint maybe of some anti-inflammatory effect, but the human evidence right now is pretty weak, very preliminary, needs much more work in bigger, diverse groups.
Understood. And then there was the mention of testosterone, animal studies.
Correct. Some animal studies suggested PDE5 inhibitors might boost Leydig cells. Those are the testosterone producers in the testes.
Might boost their function.
Right. But, and this is a big but, the review really emphasizes there's basically no solid human data on this.
Yeah.
It's speculative, mostly seen in rodents. You really can't just assume that happens in humans.
Okay, so lots of interesting threads, but clearly massive gaps remain. If you had to summarize the biggest unknowns about Tadalafil and aging.
Well, the review highlights several key areas. First, like we said, almost nothing on its direct effects on cellular aging senescence, DNA repair, telomeres, core stuff.
Right.
Second, we don't know much about its impact on muscle aging sarcopenia or metabolic stuff like insulin resistance, mitochondrial health. Third, what's the right dose for any potential aging benefit? And is daily low-dose use safe long-term, like beyond 10 years? We just don't know.
And the gender bias.
Huge one. Almost all the research is in men. What about women? We have virtually no idea regarding aging effects.
It really sounds like the research is just beginning, in a way. So given all that, what's the solid ground? What's the best advice now for healthy aging based on strong evidence?
Yeah, the review brings it back to basics, rightly so. The best supported stuff remains lifestyle.
Exercise.
Regular physical activity, yes. A good diet like Mediterranean pattern. Getting enough sleep. Managing stress. Those are still the foundations with the strongest science behind them for healthy aging.
Okay, so let's try to wrap this up. The main message from our deep dive on Tadalafil and aging.
I'd say Tadalafil shows some genuinely intriguing signals from observational studies, especially around cognition and maybe overall mortality.
Potentially linked to its vascular and maybe anti-inflammatory effects?
Potentially, yes. But the evidence is still very preliminary, lots of limitations. Crucially, no large, long-term controlled trials designed specifically to test anti-aging effects.
So the idea is fascinating, maybe even promising down the line, but it's absolutely not a proven anti-aging strategy right now.
Exactly that. It's a hypothesis worth investigating scientifically, for sure, but not something ready for prime time as an anti-aging pill based on what we know today.
A really clear picture of where the science stands. It definitely shows how complex aging is and how much more we need to learn. So thinking about all this, what questions do you think researchers really need to tackle next before we could even start to understand Tadalafil's true role, if any, in how we age? Definitely leaves you thinking. Thanks for joining me for this deep dive.